Hello and welcome to the weekly Dementia blog. My name is Dr. David Hutchings, and as always, these are being sponsored by SpectraMed. Just as a reminder, we are lecturing for the Alzheimer's Association on dementia, neuropathology, and the science behind Alzheimer's disease, and that is on November the 17th. So definitely try to log in and attend that. So I have some good information. I think mostly the audience is going to be nursing home administrators, nurses, social workers, and as well as caregivers. So looking forward to that presentation as well. So as promised, we want to talk about this week is facility placement, and this is extremely difficult decision to make anyways. With the pandemic on top of that, with COVID-19 on top of that, it makes the decision even much more difficult. So let's talk about this in terms of dementia stages. So we've talked about in previous blogs, we have 7 stages of the disease process. No matter what type of dementia, again, 85 different forms or conditions that can cause dementia. In general, we have stages 1 through 7, despite the type. Once we get to stage 3, that is what we call mild cognitive impairment, or MCI. This is something that can be dealt with in a home environment. Many patients function quite well at a stage 3, but once we get into stage 4, then we have mild dementia. Stage 5 is a game changer for us, because that is at the stage where the patient can no longer survive without some kind of 24-hour assistance. So they're going to have increased help with activities of daily living, like bathing and dressing, those types of things. Mobility is another issue that starts to come into play there. And also, as we advance into stage 5 and even the early stage 6, we have a condition called agnosia, where the patient's unable to recognize maybe their grandchildren or children or even their spouse. So those are some things that we have to look at. When it comes to facility placement, number one is definitely with the COVID-19 pandemic, checking out the facilities to see, in terms of your state and what the requirements are for visitation, if you are able to go in and visit. I know that I rounded multiple memory care facilities, and some of those are under quarantine, some of them are not. Some people can come in, some people can't. So it really depends. So that's the number one thing I would look at. If we feel like we're not quite at that point of needing full-time care, I am a huge fan of respite care and bringing in caregivers to help out around the house. Maybe just sitting with your loved one 2 to 3 times a week and allowing you to get out and get a little bit of a break and kind of restore yourself a little bit, because it is obviously a huge burden on caregivers without that break. So respite care is huge. If you have any questions on respite care, I'd be happy to recommend a couple companies that are very great that I've used with my patients before. Next is I would look at the facility and see that does the facility offer kind of a range of in terms of severity. So I know that some facilities will have different floors, meaning that your one floor may be for more for your 4 and 5 stages, where your next floor up maybe for your 6 and 7 stages. So it kind of separates the patients who are a little bit higher level versus the ones that are more severe, more profound. And then lastly, I would make sure that, again, with COVID, that's another big piece here, is that some of my patients are actually moving into the center with the patient so they don't have to be separated. So that's also another option. Other things I would look at is the availability to keep your own primary care physician within your facility, as well as other things in the facility may offer, such as activities. That's a big one that can help decrease behaviors by kind of distracting or redirecting patients as well. So there is a lot to be thought of in terms of facility placement. It is an extremely difficult transition for spouses. I can't hardly even wrap my arms around what that would feel like. So it is very important that you put your loved one in a facility that has high star ratings, one that has low hospitalization rates, that has good activities, and possibly that, again, can separate based on severity. And then lastly, I would look into, does the facility offer therapy services in-house, or can you bring in home health if the need arises when gait begins to decline, or maybe occupational therapy for some of the ADL assistants. So we're going to continue our series. Actually, we're going to start a new series next week. We're going to be talking a little bit more about genetics and some of the science behind the disease, and that's going to help coincide with the lecture that we have coming up in November. So again, thanks for tuning in every single week, and we will see you again next week. Thank you.